Hey, it's Lou, and here's the thing. Getting sick is expensive, especially in the United States, where some 65 million people are either uninsured or underinsured. No wonder then that medical bills are among the leading causes of personal bankruptcies. As a solution, many Americans are using crowdfunding campaigns on sites like GoFundMe to pay for treatment. Even in countries with universal health care, these platforms are increasingly used to fill gaps in coverage and provide a desperately needed safety net. However, critics worry that crowdfunding campaigns turn medical coverage into a popularity contest in which social media savvy could be the difference between life and death. Biases regarding who's worthy of help might dictate who gets better and who's left wanting. And finally, if we participate in crowdfunding medical bills, are we perpetuating a broken system? What's the best way to allocate medical resources? Professor Jeremy Snyder, an expert in public health ethics at Simon Fraser University, told me in countries that have universal health care, i.e., every developed country except the US, the ideal system favors efficient treatments that do the most good for the least amount of money. The neediest patients are prioritized. That system assumes that health care is a human right, that everyone is entitled to treatment. And that fundamental idea that healthcare is a human right, which is supported by most Americans, is in conflict with crowdfunding campaigns, where not everyone is treated as equals. Donors pick and choose who is the most deserving. Different campaigns compete in a sympathy market that encourages sick people to disclose all types of personal information in order to attract assistance. Snyder calls it the commodification of illness. Professor Lauren Berliner, a media scholar at the University of Washington, Bothell, told me that these types of appeals aren't a totally new phenomenon. They bring to mind celebrity telethons and commercials that show starving children in foreign countries in order to solicit donations. What is new is that your friends and neighbors are now the subject of these campaigns designed to tug at heartstrings and open up pocketbooks. For a lot of people, there's something degrading about this process. Not only do you have to waive your privacy, putting yourself out there with photos and written appeals that can exist on the internet forever, but you're opening yourself up to judgment. Plus, this system creates a strong incentive to exaggerate your condition, to paint a really bleak picture that stands out among the thousands of appeals simultaneously listed on crowdfunding platforms. In this way, there's a bizarre element of performative suffering, a competition about who is worse off. Keep in mind, the crowdfunding platforms may be a lifeline for those in need, but they're also profiting off of charity. Personally, that feels a little gross. Some take percentages on the raised funds, others ask for a tip. Now, don't get me wrong, it's certainly noble to help someone in need, and there's something appealing about donating directly to a person as opposed to an organization that might spend money on overhead expenses. From the patient perspective, a community, internet or IRL, can be a great source for support. But when that support comes at the whims of the crowd, aid might not be distributed equitably. Berliner told me that donors bring biases, which are often invisible to them, to these campaigns. For instance, studies show that we most empathize with people who look like us. That might put minority groups at a disadvantage in the sympathy market. But it's not just ethnic, religious, or racial hang-ups that impact who we give to. Berliner said we also have ingrained feelings about who is deserving of help. Fairly or unfairly, many potential donors might consider sexually transmitted diseases as unworthy of assistance. Ditto with ailments associated with drug use or alcoholism. In other words, some sicknesses are less appealing than others. You have to be the right type of sufferer. Berliner and a colleague at UW-Bothell, nursing and health studies professor Nora Kenworthy, studied 200 crowdfunding campaigns launched to support healthcare. One campaign for a little boy with cancer is emblematic of what works. The organizers essentially created a brand. There were hashtags, taglines, memes, constant updates, high-res photos, even costumes that integrated with the campaign's superhero motif. For maximum transparency, details on how the donated money was spent were also posted. These features are all consistent with the traits of viral marketing campaigns hatched by professional ad agencies. On the other hand, some of the campaigns Berliner and Kenworthy studied that failed to raise much money had spelling errors, vague descriptions, technical issues, and low-quality photos. Now, storytelling might come naturally to some, but it's also a learned skill, something frequently honed in college or in a career. In other words, the type of social media savvy that fuels fundraising success is often associated with privilege and access to education. But even if you're very proficient in crafting a narrative and drawing attention, some ailments aren't exactly marketable. Certain medical situations are so complicated, or frankly, so gross, that they're hard to summarize in shareable tidbits. Therefore, the more complex an ailment, the tougher it often is to raise money. People also struggle to communicate about mental health problems. In my humble opinion, articulateness is a weird prerequisite to getting life-saving care. Moreover, the outcome of these campaigns frequently relies on people's real-life social networks. The bulk of donations come from friends, family, coworkers, and people you peripherally know. Again, this is a system that privileges wealthier and well-connected fundraisers, people who might have contacts in media or among internet influencers that can shine a spotlight on a campaign. Granted, if you're crowdfunding, you're probably in dire straits, but the importance of social networks means the neediest on crowdfunding sites are often at a disadvantage. The impoverished tend not to know many people with money to spare. That's why Snyder told me crowdfunding often exacerbates inequality, and certain groups like immigrants or even just introverts might struggle to make connections, which means not only are there no obvious donor candidates, but the campaign is less likely to be shared. Another concern is that unproven treatments that could be wasteful or even dangerous might wind up getting funded. Snyder told me this is often the case with stem cell treatments. Insurance companies, for all their obvious and glaring faults, are able to vet what works and what might provide false hope or even adverse outcomes. But the crowd lacks that type of expertise. In addition, it's hard to tell if someone is flat out lying, making up their sickness to fraudulently attract donations. Look, this is pretty clearly an imperfect system that is a little too easy to exploit. It rewards popularity and storytelling skills. It plays into culturally crafted perceptions about who deserves our sympathy. For a lot of people, that's unfair. It leaves them wanting. Berliner and Kenworthy found that 90% of the campaigns they studied did not meet their fundraising goals. The average campaign netted just 40% of its target. But the question I kept coming back to is, this is better than nothing, right? I mean, it's delivering real aid to those who need it. All the experts I spoke to pretty much agree with that assessment, but Berliner told me the danger is that crowdfunding placates us. We might think it's a viable resolution to the failures of the healthcare system, so we don't want to fight for a better way. Snyder added that it might alleviate political pressure and make us less inclined to demand healthcare reform from our elected officials. Meanwhile, Kenworthy told me there's something uniquely Silicon Valley about the crowdfunding approach. It looks at a massive problem and offers a quick fix solution. It has little regard for privacy. It bypasses existing institutions like nonprofits and the insurance providers and props up the sharing economy and social media as a way forward. But that's clearly not enough. Crowdfunding is like putting a Band-Aid on a gaping wound. The US spends the most money on healthcare, yet somehow has the worst health outcomes among high-income countries. This is unacceptable. And if we have to supplement this sick system with the digital equivalent of passing around a hat and asking for handouts, then we're a nation that doesn't value dignity or equality. Okay, I'm gonna go live my life.